Okay, now we're going to talk about the lower part of your appendicular skeleton. So we're going to talk about the pelvic girdle and the legs. First of all, if you look at the pelvic girdle, it's made of an os coxa here, an os coxa here, which together you call them ossa coxa, and then the sacral bone right here. So those join together, and that forms that pelvic girdle, which holds each leg on. So let's start looking at all the individual bones here. We'll start over here with your os coxa. Now, you've got a right and a left os coxa, and you've got to figure out how do these things go. Well, the easiest way, the Mickey Mouse way to do it, is to think Mickey Mouse ears. So what I do is I take the Mickey Mouse ears, and you know the ears have got to be sticking up. Does it go this way or this way or this way? You've got to just kind of figure out. So you stick your ears up, and then you look through the little eye hole here, and then you make sure that cup is sticking out, and that's going to be your right os coxa, and then you do the same thing on the other ones. So when you do it, you look like you have Mickey Mouse ears. So in order to make sure that you've got the right one, again, you want this little cup right here called the acetabulum, which we'll come back to. That's going to be forward or anterior. You want the ears flared out, and then you want this little straight part right there. That's the pubic symphysis. That's where the two come together or join. Symphysis means join. So that has to be in the middle. So this has to be a right os coxa. And that would make this one, if you mix it around and then you put it how it's supposed to be, get that straight edge right there of the pubic symphysis, the eye hole in front, then the ears coming out, and then that acetabulum looking forward. So you've got now a left ossa coxa. So the left and right ossa coxa come together, and then you join those together with your sacral bone here. And remember, we talked about the sacroiliac joint, which was that roughened area on the edges of the sacrum. Well, now we're going to put that roughened edge here of the sacrum. Stop. Oh, she's going to hold it for me. Okay. That is the sacroiliac joint there. So we kind of put all this together like this, and you form a nice little pelvic girdle. Okay? Now, let's take it apart and we'll talk about all the different parts. And remember, when we're talking about male and female models, this pelvic girdle is going to be looking very different due to the effects of estrogen and testosterone on bone formation. All right, we'll start with one os coxa. Now, this is actually a fusion of three different bones. The ear part here of Mickey Mouse is basically formed by what we call the ilium. If you think about like, well, I hate this anatomy lab, and if you put your hands on your hips, what you're doing is you're putting your hands right there on this crest of the iliac bone. So that's called the iliac crest right there. Then also part of the ilium, you're going to see this sacroiliac joint where the sacrum comes in there and joins right there like that. And so that's part of that ilium bone. Then you've got what are known as the greater and lesser sciatic notches. So if you look from the side here, you'll see a big notch there and another notch there. So that's the greater notch, and then that's the lesser sciatic notch. If it's a notch, it's got to have something going through it, so you have blood vessels and nerves going through those greater and lesser sciatic notches. And sometimes when you stand up and bend over and do different things, you can kind of turn this and kind of pinch some of those nerves and cause sciatic pain that goes all the way down your leg. All right, another thing you're going to have on the ilium bone, or actually it's part of the ischium too though, is this big cup right here that's called the acetabulum. And that's what holds the bone of your leg into your, that connects the bone of your leg. So you've got the head of this femur, this big upper bone of your leg. It sits in that cup right there. That's a ball and socket joint right there that it can rotate around in, and that gives your leg a lot of flexibility. Remember, your ball and socket joints are the most freely movable, so you get all that flexibility there. So that's the acetabulum, okay? So all of this pretty much is your ilium. Then you have kind of, if you just kind of draw a line through here.
Yeah, can now start. Good.
Okay, if you kind of draw a line right through the middle of that hole there, that hole is called the obturator foramen. You have, from this place over, you have the pubic bone, and then this down in here is the ischium. And your book does some really good colored pictures that kind of help you separate out these bones. And we're not going to ask you where the dividing line is between the bones, but just know you have ilium, ischium, which makes this bump here, and then pubic bone right here. which makes the symphysis, or the joining together of these two bones, if I can get it turned around right. Like that. So we got that. All right, so let's look at the ischium here. Right there, you've got what's known as the ischial tuberosity. And that's when you have somebody, like a little kid will come and just jump in your lap and sit down on your leg and you go, oh, your butt bone is killing me. Well, that's the butt bone right there that you're feeling. So that's the ischial tuberosity, part of that ischium. Then you have the pubic bone right here. And the only two parts you need to know about this are the pubic symphysis. Remember, symphysis means joining. So you join these two bones together, and you have that kind of flattened area with this made up of the pubic symphysis. And again, you've got cartilage in between there that keeps those bones from rubbing together. And that cartilage will soften up when a woman has a baby. The pregnancy hormones, the progesterone, will allow that cartilage to kind of soften up and allow these to expand a little bit for pregnancy and delivery. Also notice that when I have these bones together like this, you have what's known as a pubic arch. You see the little arch right there? That's going to be important in determining if you have a male or female skeleton. If you have a small pubic arch where it's just a narrow arch like that, that's more indicative of a male, whereas a female is going to have a large, wide pubic arch like that. And again, that's form and function. You've got to have this larger arch to increase the girth here, so you have a larger opening so you can deliver the baby. So that's pretty much your os coxa. So one is an os coxa, two are ossa coxa. And remember the little parts here. You've got the flap up here. This is your ilium, your iliac crest, your sacroiliac joint. Then you have the greater sciatic notch, the lesser sciatic notch. Then you have the ischial tuberosity, the obturator foramen, which is the largest foramen in your body, the pubic symphysis, and then the acetabulum, where your leg connects, or your bone connects to your leg there. Then you've got blood vessels and nerves going down through this obturator foramen. So that's your ossa coxa. Then your ossa coxa is going to articulate with this large bone of your leg that's known as the femur. Again, if you will get the femur oriented correctly, you can name the parts real easy. Well, I already told you, you've got a ball and socket joint right here where your femur articulates in there. So you know that's got to be the proximal end. So if this is the proximal end, does the ball join like this? No. So it's got to join like this, where it's joining into the body. You don't want to have that ball sticking out to the lateral side. So now you've got to decide, well, is this the front or anterior, or is it the back? Again, always look for that big pit at the distal end, just like you did on the humerus, and that tells you that's the back side or the posterior side. So this is anterior, and this has to be medial because that's what's attaching to my body. So that can't go this way in my, I'm showing it in my arm. It can't go this way. It's got to go this way in my leg because this is medial and this is anterior, so that's the only way it can go. So that makes this a right femur. Okay? Now, let's name the parts of the femur. Well, you've got the head up here, which is that rounded part, and you'll see a little opening in the head of the femur. That's known as the fovea capitis, and that's where blood vessels and nerves run through. Remember, your bone is very vascularized. It's got lots of blood supply to it. Each osteon has that central canal that has a blood vessel and nerve in it. So you've got a large opening there for the blood vessels to go through called the fovea capitis, and that's the head of the femur. And then you have the neck of the femur, which holds the head on. Now, remember, I've got this side anterior. If you look at the posterior side, you can see two big bumps. These are attachment points for muscles. This bigger bump on the top is called the greater trochanter, and the one on the bottom is called the lesser trochanter. You can see them from the anterior side as well. That's going to be your greater trochanter, and then that's going to be your lesser trochanter. So just remember greater and lesser, and they're trochanters because those are attachment points for muscles. So we know now that this is the medial side of the bone. So if we will follow the medial side down to the distal end of the bone, we can figure out what our bumps are down here. On the distal end of the bone, you're going to see two big rockers here. Remember, a rocker is called a condyle. So if this is the medial side of the bone, this is going to be our medial condyle. And then that makes this our lateral condyle. Well, if you've got a medial and lateral condyle, you're going to have a medial and lateral epicondyle. And you can see those better from the back side. So this is now our medial side. There's our medial condyle. So there's our medial epicondyle. Remember, epi is above or upon. So that's your medial epicondyle. And then coming from this side, that's your lateral side. So you've got your lateral condyle, and then you have your lateral epicondyle. And that's really all you need to know on this bone. Then you go to the next bone, which is called the tibula. This is what you're not supposed to say. It's the tibia. Don't call it the tibula. You have a tibia and a fibula. Don't call them the opposite, which I don't even want to say. So tibia, fibula. And these bones are going to articulate with the femur here. So if you look at the...
It has a leg.
Yeah, there you go right here. We've got a leg right there. So they articulate like that. So there's your femur coming down, and then you have the tibia. And see those two condyles here, the medial and lateral condyle? They're going to articulate right there on the top of that tibia. And then the fibula is going to articulate right there on the back side of the fibula. See, I'm doing it. It's because I'm trying to think not to do it. Tibia, fibula. Okay.